Hi, this is Dr. Katina again with the Paragon Scoping Review Study, and this is the video tutorial on tab 4 regarding documenting experimental conditions from your article. The first question is, was there more than one experimental condition or group or intervention that was tested or compared? If you've been following along with this, mine was a randomized clinical trial, and in the methods, they clearly state that they had two groups that they randomized. So there was more than one condition. If you have yes, you're going to have perhaps different options than if you click no, then some other things might pop up. Throughout the form, I want this to alleviate concern that there's not going to be an option, just from this menu for what you click. Like if you click other, there should be an option like this. It should be that way throughout the form. If something like this is not working and there's not an option for you, again, please email me, katinak@duq.edu, and these can be changed very easily. Things can be added, things can be shifted or adjusted. Or if you have a question, whichever it is, please email me if there's any issues with any of the questions like that. Because if something's going haywire, I can fix it pretty easily. So again, for my paper, there was more than one experimental condition or group that was tested. So yes, there was more than one intervention compared. There was the usual care intervention, and then there was the prehabilitation group. So in naming these groups, I'm going to put the first one, they called that their usual care group, and it was their control group. And according to just want to make sure, in the usual care, there were 77. They actually listed it second here, but in the results down here, they listed first. So I'm going to keep this first. And then you just click it here and add another. And then the other one they called it prehabilitation. And throughout the paper, they called it the HIT group, which was their high intensity interval testing group. But for the purposes of their results, they're saying group. So, and this was, I would say, intervention 1, and the N was 74. So what was intervention? If more than one intervention, what was intervention 1? This is for, if there wasn't a control group, but we're also going to just go ahead and give a little bit more information here also. So for intervention 1, we can say was just usual care for aerobic training lung cancer. So for pre-surgical lung cancer. And then if more than one intervention, what was intervention 2? It was prehabilitation. I mean, that's what they called it, but it was really, I'm just wondering if you need to get more specific here. I mean, in their methods, they really talk about this high intensity interval training that they did with the intervention group. So I would actually put that here. I would say it was high intent. They called it their prehabilitation group, but it was the high intensity interval training group. And later on, we'll be able to say that this was biking. So there was not a third intervention, so you can just put NA. And there were 3 times that they collected data. And at first, this was a little bit confusing because at first they made it sound like if you look in their results, they made it sound like they were collecting data for each patient in the beginning, at the middle, and at the end. And I think that they were. If you look in their methods, they say that, at enrollment, patients performed a 6-minute walk test, which was our secondary outcome according to the ARSCTS guidelines. And then they talk about how They also, at enrollment, perform their aerobic intensity test. And that's explained up here. And their results are reported really pre-post, and that's what they were looking for, again, for their primary endpoint was pre to post aerobic capacity change in the 6-minute walk test. But they took measurements 3 times. They took measurements in the beginning, in the middle, and at the end. And that is how they analyzed it as well. So for each patient, it was in the middle, first, in the middle, and last. And that's how they analyzed it. And then their reports averaged it out to be pre and post. So I'm going to say that was 3 times. We could put in there, we can't. So I would say 3 times they collected data. That's what I would say. Okay, I'll come back for the next video. Maybe we'll discuss conditions in group data. So I'm going to hit save and see you in the next video.